Well, good morning, everyone. Our meeting for the Healthcare Licensing Subcommittee for the Governor's Healthcare Licensing or the Licensing Task Force will come to order. And Ms. Pratzer, will you please take the roll?
Oh, Lisa, do you want me to?
Yes, please.
Okay, thanks. Good morning, everybody. Okay, we will start with Representative Etchart.
Here.
Tony King.
Here.
Senator Harvey.
Here.
Senator Noland, I believe, is absent today. Senator Zolnikoff.
Here.
Representative Seconder. No. Dr. Harrington.
Here.
Great. Stacey Anderson.
Here.
Dr. Brewer. No. Webb Brown.
Here.
Representative Buttrey.
Here.
Jennifer Hensley.
Here.
Brad Longcake.
Here.
Kristen McCauley.
Here.
Amy Narrison, she said she was going to be a little late today, but she will be here. Allison Paul. No. Sierra Reesberg.
Here.
Jason Small.
Here.
And Gail Tronstad.
Present.
Great. Thank you. That is the subcommittee. Madam Chair, and for staff today on the call, we have, I'm Erin Sullivan, Policy Analyst for the Department of Labor. For our legal counsel, we have Jennifer Stallkamp. And for technology and Zoom coordination, we have Lisa Patzer. And then I see Kevin Bragg is also on the call. And I believe the commissioner will be joining us later, but she is at another meeting. So that is it for staff.
Well, excellent. Good morning, everyone. So as you know, today we have a fairly big agenda, but I really think it's pretty straightforward due to all the hard work that everybody's put in. But today's subcommittee meeting is we're going to focus on reviewing the recommendations developed over the past several months to reduce the unnecessary licensing barriers and address healthcare workforce shortages. And we're going to improve administrative efficiencies and modernize Montana's professional licensing system. And really today, as we look at review and approval, on 1 through 8. Ms. Sullivan did an excellent job sending out the items for review. So what I would like to do is if anybody has any specific questions or comments on 1 through 8, I think we should be able to go through this fairly quickly, but if you want to just look at those for a second, and then I'll just start by saying the licensed addiction counselor reciprocity and educational barriers. Anybody have any comments or concerns on that?
Madam Chair, real quick, would you like me to put this document on the screen so everybody can see what we're looking at?
That'd be great. Thank you.
Okay. I will try. Okay.
I'm happy. I have a quick summary of each one of these as well. That's maybe a 30-second summary. If people need me to read it, I'd be happy to do that in each one as well. Why don't I just do that? So the issue with the licensed addictions counselor reciprocity is current Montana licensure requirements can make it difficult for experienced addiction counselors from other states to become licensed, particularly when there are other educational pathways differ between states. So the recommendation was to remove the unnecessary educational barriers, improve reciprocity while maintaining competency standards, and help address behavioral health workforce shortages. This would just make it easier for counselors to come to Montana, and it wouldn't lower any standards. Any questions or concerns about number 1, licensed addiction counselor reciprocity? Okay, we'll go ahead and move on to behavioral health terminology. What this really is doing is it's just modernization and standardization and of the terminology where any inconsistency exists. For example, mental health, behavioral health, substance abuse disorder, and addiction. It's just a cleanup for clarity and consistency. Any questions? Okay, EMS licensing alignment. There are different renewal schedules, create unnecessary administrative work for EMS providers in the state, and we are trying to align the renewal cycles wherever possible. This just creates administrative efficiency with little or no policy change. Any questions or concerns on 3, EMS licensing approval alignment? Okay, and then number 4 would be the DLI license lookup tool. This is just going to make it easier for public access. Questions or concerns?
Madam Chair, I would just note on that it's not just for public access, but it's eases up the requirements for providers, hospitals to check the licensing status of their providers. And so I think this is a good one to help cut administrative cost.
Thank you. Excellent. Speech language pathologists. This would be a workforce improvement to modernize licensure, reduce unnecessary barriers while protecting patient safety. Questions or concerns? And then your international physician pathway. This, while maintaining safeguards, it can create a pathway for allowing qualified physicians to become licensed after supervised practice. And some internationally trained physicians can't practice despite extensive experience. So this would create a pathway for international physician licensure. Any questions or concerns regarding this? Okay. Social work supervision hours. These would become more flexible while maintaining competency, and it deals with the current supervision requirements may unnecessarily delay independent licensure. Questions or concerns? And then last one, the National Practitioner Data Bank query. This would remove unnecessary burdensome regulations for pharmacists. Okay, questions or concerns on any of the one through 8 on our agenda for this morning? So we will move all of these forward for approval. Ms. Sullivan, is there anything that we need to do formally to say that we're moving these through for approval to present at the meeting on August 21st? August 21st in Butte.
Yes. Thank you, Madam Chair. No, unless anybody has any changes they would like to make on these recommendations, this is the same format that we presented to the full task force back in June, and so that's why I prepared it the same way. I will note that of the 8, there will be 2 of the 8 that will have statutory changes, and it is, I'm just going to scroll up. The rest of it is going to be just guidance. And so the behavioral health terminology will require statutory change. And so we've actually already had a meeting with DPHHS to talk about what that looks like. And that was one, I'll just point out, this subcommittee had asked for a crosswalk or a listing of potential statutes that may need to be changed. And so that is something we're working on. There's possibility we could have a draft prepared or a little more information at the August meeting as to what that draft would look like. But just note that will definitely be a bill that we'll have prepared coming out of this task force. And so you can see these are all the potential statutes. Again, we're still working with DPHHS to see exactly which ones will need to be changed. And Ms. Stallkamp she may have more information on that, or if you have questions, you can ask her because she was in that meeting. And then the other one that we'll actually need, the rest of them again are guidance, like the EMS license renewal one is a rule change or a procedure change. And so we don't actually have to change statute to make that change, which is really nice. And then, but the only other one that I did want to point out that is a little different is that will require statutory change is the social work hour requirements. Is it this one? So this one, I just wanted to point this out that in order to align with the compact requirements, we do need to make a couple statutory adjustments for the hourly requirements for the LMSW and LBSW licensure. And so you can see right here under implementation considerations. So this is what will be amended. And so that's what the statutory change that will be needed, and we can certainly come up with a draft for the full task force to look at the August meeting. So there will be two bills that'll come out of these 8 recommendations, and the rest will just be guidance for the department or boards for policy changes. And that's what I have, Madam Chair. But otherwise, these recommendations, we can just move forward to the full task force in August.
Excellent. Any questions or concerns from the committee? Okay. So we'll move on to additional information and review. The insurance and licensure credentialing timelines and standards. Representative Buttrey, if you're on, I believe you might be able to provide some more information on this. If you wouldn't mind giving us a summary on this, I think you'd probably best suited to do that for us.
Thank you, Madam Chair. I don't know how much of a new update I can give, but the idea is to standardize the credentialing process mainly for the payer community, so that instead of having separate processes by each payer, this might even go into the hospital realm, that we unify those standards so that once you're credentialed across all the payers throughout the state. Now, I know we're having a condensing of payers, non-government payers in the state, but I think if we can set up a process where someone can submit the information, whether it's for initial credentialing or repeat credentialing, that there's one entity that receives the information, reviews it, and then that becomes applicable across the state.
Thank you, Representative Buttrey. Anybody have any questions or concerns regarding this? Excellent. Okay, let's move on to Gentris scope of practice.
Madam Chair.
Yes.
So for these information requests, my question for this subcommittee is, at the last meeting, you had asked for additional information. These weren't necessarily going to be full recommendations to move forward. So based on this additional information that was provided, and hopefully you all had some time to look through it this week, is this okay to just let the private market deal with this, or do you want to actually talk about this at the August meeting and continue on with a recommendation from the task force on the insurance credentialing and suggest that a study bill be introduced at the next session, or are we done with this topic? I would like that answer for all 3 of these informational requests, just so we can close the loop or continue on. Thank you, Madam Chair.
Thank you, Ms. Sullivan. Ms. Hensley?
Thank you, Madam Chair. Erin, from my perspective, and thank you for this thorough preparation that we were provided. I acknowledge that I don't think the work is done on credentialing specifically or many of these broad topics. And I also acknowledge the limitations of this subcommittee and task force at large, knowing that our focus is Title 37. So I just want for the record to state that I know that outside groups are moving forward on some of these suggestions, some of these ideas. It doesn't mean that they're going to go away entirely. This is for also the public that may be listening to this. These aren't going to go away entirely. It's just that this specifically may not be under the scope of this subcommittee to move forward. I think that credentialing is an important conversation that needs to be had, is having outside of this group. But if we don't move further on it on this subcommittee, it just means that it's not within our scope from my perspective. Thanks for that.
Representative Buttrey. Thank you, Ms. Hensley.
Yes, thank you, Madam Chair. I do support bringing this forward to the August meeting. I think this is a good item to reduce administrative burden. We are working on this outside of the state realm. We have a provider payer working group that is working on this, but I think bringing it forward, letting everybody know what we're doing, making sure that we're getting all the correct parties to the table, and talking about ways that we can reduce red tape and administrative burden. So I agree that this doesn't likely take any sort of legislative policy change, but I think it is something the industry should be aware of and should hopefully get behind.
Thank you, Representative Buttrey. Ms. Sullivan, does that give you the answer you need to your question about bringing it forward to the August meeting for discussion in support of this group, even if it doesn't require any statutory change?
Yes, Madam Chair. Thank you, everybody. That's fine with me. That's good direction. I will just add this document to your packet for the August meeting. I'm not going to change anything. And so you can just plan to have this conversation. And if Representative Buttrey has any additional updates in a month that he wants to share with the full task force at the August meeting, then that'd be great. So thank you for that direction.
Yeah, and Madam Chair, I'll come with a report. We'll host another provider payer working group and we'll come with a full report for you.
Thank you, Representative Buttrey. We'll count on you presenting that portion of it in August.
Okay.
Any further questions on that topic? Okay, let's move on to the denturist scope of practice. Primarily what it seemed to me in reviewing it was that this is largely informational. It's to possibly consider a limited radiology license, but there's not really any immediate recommendation to substantially expand the scope. Mr. Brown.
Thank you, Madam Chair. Webb Brown, Montana Dental Association. Looking through this, we've had some discussion about this as well. Just not convinced there's a necessity for this and not convinced there's a workforce barrier, which would be basically what this task force is tasked with. I just don't think that we need to take this forward. That would be my position. Thanks.
Any other comments or concerns from the committee? Okay, let's move on to behavioral health recommendations. Ms. Sullivan, did you want to provide a quick overview of this for the committee?
I can certainly try. Thank you, Madam Chair. So this was just at the end of the last meeting when we were after we went through the high response recommendations. The Chair King asked if there was any other recommendations that anybody wanted any additional information on. And these were the ones that came up as far as maybe just some, and I believe it was Ms. Riesberg that wanted just a little bit more information on some of these behavioral health ones. And I don't want to call you out, but I think you said that maybe some of these could be addressed just through talking with the employers, Ms. Riesberg. And so I just pulled these together, and I think that you just wanted some more information. I don't know if you actually wanted to move forward with any of these, but I just kind of did a little summary of the three recommendations that you mentioned, as far as what the level of support was for moving forward with them, some follow-up issues, and then suggested direction on each of them. So I don't know, Ms. Reesberg, if you would like to speak to this memo at all, if you'd like to move forward with any of these, or if this is satisfactory.
Thank you, Chair and Aaron. Yeah, a lot of this was just really helpful information. I would be interested in hearing if there's support from others with moving any specifics forward. Um, I have a few thoughts, but would like to hear what others think too.
So, Ms. Sullivan, I'll kind of just summarize as you pull forward. As you can see, recommendations 11, 12, and 18 would be to move these into a more cohesive work stream. So one of them is the supervision of candidate therapists. This would clarify whether candidate therapists must be W-2 employees, and then it requests clarification for guidance whether the board or the DLI rather for any statutory changes. And right now, Blue Cross Blue Shield requires 100% proximity for any supervisors for supervision of candidate therapists. So it would loosen up some of that, or the recommendation would be to consider that or look at that. And then 12 is social worker candidates, and that these would be able to be billed through, I believe, Medicare, Medicaid, and TRICARE. And correct me if I'm wrong on any of this, Ms. Sullivan. And then recommendation 18, which I really think it would be good for us to look at. It's reducing barriers for already licensed LCPCs and licensed clinical social workers who want to become licensed addictions counselors. So I really think that even if we're not too keen on 11 or 12, but that we look at recommendation 18, which would help licensing more addiction counselors. Does anyone have any problems with moving those three forward to the August meeting?
Yeah, Chair, recommendation 11 with the Blue Cross Blue Shield proximity policy, I believe that's been resolved. Blue Cross Blue Shield updated their policy, so I don't know that that one needs to go any further. However, the W-2 question is one that that I don't know the answer to, and so that might be something that we would want to move just to get more information on.
Ms. McCauley?
I just wanted to add, thank you, Chair, that I do support recommendation 18. I think that's a good one to move forward. The LCPCs, their master's prepared, they've got that skill set. It makes perfect sense to move that one forward. Thank you, Chair.
Thank you, Ms. McCauley, and thank you, Ms. Reesberg, as well. Ms. Hensley?
Thank you, Madam Chair. I had more of a question for others on this subcommittee that maybe have some more perspective on recommendation 18. I'm looking at this one, and I remember our initial conversations around it, around Montana's need for more LACs. But then we had 2 no and 5 table vote, and I'm just wondering if that was because folks didn't feel comfortable taking the position, wanting more information, which is completely acceptable, or if there's a strong feeling against. So I guess I just wanted to see if anybody had some perspective they can provide me on why this would be opposed or not supported by industry.
Ms. Anderson, I saw you had your hand raised.
I actually don't have an answer for Jen Hensley. I was just raising my hand to support Initiative 18.
Ms. Hensley, maybe it just looks like people didn't have quite enough information about it,
Okay.
because it certainly looks like it has a lot of support now. Do you think,
Got it.
does that
Okay.
answer your question? Maybe?
Yep. Thank
Okay.
you very much.
Some of these things can get pretty technical, and there's been an awful lot of information for members of this subcommittee to digest. So maybe that was just kind of an issue there, because it certainly doesn't look like we have any barriers moving forward. I think this is an excellent recommendation. Okay.
Okay, so thank you for all that information, Madam Chair and committee members. So out of that, I'll just pull out recommendation 18 and develop that a little further. I did get some information from our licensing bureau on if you look under here, there's been comment and discussion about the gambling, the hours for gambling and how that's pretty unique to Montana. I believe there's one other state that requires that. And so I do have that information. So I'll do a little more work on this to prepare the recommendation for the August meeting. So more to come on that. So thanks for the direction on this document.
All right, excellent. And then moving on to administrative burdens, licensing boards and programs, and composition and governance. Many of you on the committee may have gotten a whole bunch of emails and communications from different optometrists around the state. And I think that's absolutely wonderful that optometry is very involved in their profession. But one of the things I just want to point out and just reassure people going forward is that to the recommendation or the consideration, or just even for just a minute on it, it was whether optometry should be moved under the Board of Medical Examiners or converted to a program. And it did not, those two recommendations did not receive enough consensus going forward for the board or for this licensing subcommittee to move that recommendation forward. So given that, I think that that's how we should start this out for anybody waiting or concerned to talk about this. So just to reiterate, there were two different things that didn't receive enough support to move forward, specifically that we're talking about here. That was to merge massage therapy and chiropractic into an alternate health board. That did not receive enough support, and neither did moving optometry to a program or to the Board of Medical Examiners. So for all practical purposes, those two are staying where they are as far as this subcommittee is concerned. Ms. Sullivan, would you say that's a fair assessment?
Yes, thank you, Madam Chair. So I put the survey results summary on the screen right here, and basically what Chair Etchart is alluding to is this 75% threshold, and that number is what I used when we went over the public comment survey, just kind of to give a bar of what is high support. 3/4 of the people that responded is an okay start. So you could see that based on the options that were provided, there was really only one that I'm sorry, there was two. Options 4 and 5 together kind of go hand in hand. This healing arts licensing program and nursing home administrators within the healing arts licensing program got the most support from everybody. And then also behavioral health and psychology together. Those were the only two actionable options that exceeded the 75% threshold. The other one that exceeded it was just the do nothing option, which is what I explained at the last meeting, was the large high volume and already integrated boards like Board of Medical Examiners, pharmacy, all of those boards that are already very large and complex, just keep those the way they are. Obviously, those were those got met the 75% threshold. But the two options that were kind of, I guess I would say controversial, that we did receive a lot of public comment on, those did not meet that 75% threshold. So there was, people either really liked it or they really did not like it. And so option 2 for merging massage therapy and chiro into alternative healthcare only got 60% yes from the survey respondents. And then option 6 for considering moving optometry at all only got 62.5%. So at this point, you can certainly still have that conversation but based on the survey results, those did not meet the threshold to move forward in this conversation, Madam Chair.
Thank you, Ms. Sullivan. Mr. Brown?
Thank you, Chair Chart, Webb Brown, Montana Dental Association. I would agree with that. Just leave option 2 and option 6 off the table at this point in time. Thank you.
Thank you, Mr. Brown. Anyone else? Ms. Hensley, did you have your hand raised? Okay, perfect.
No,
So,
if I did, I didn't mean to. No.
oh, I wasn't sure you popped up. I just didn't want to miss you for any reason. Okay. No. All right. So then the recommendation is to keep the large high volume boards, which would include nursing, medical examiners, pharmacy, dentistry, and other large already integrated boards as they are, and just focus on improving any processes rather than restructuring. And then the other large consensus was to create a combined behavioral health and psychology board where we can look at doing this, where it would merge behavioral health with the board of psychologists. And this maintains an adequate psychologist representation, and it would have to continue to maintain any stakeholder input before implementation. So that received an 81% approval. Does anybody have any comments on that specifically? Okay. And then, of course, convert nursing home administrators to department administrative licensing program. It would eliminate the standalone board, and it would move the licensing into the healing arts program, like Ms. Sullivan said. And then, of course, to look at moving CNAs, and this received 100% unanimous support. All right. Questions or concerns regarding that? Okay. Ms. Sullivan, what do you need from us to move forward with those recommendations?
Madam Chair, I don't think I need anything. So based on these, what you can see on the screen, there's four numbers here. There really will only be 2 options that I think will be that we should present at the next meeting. Like I said, this option 1, retaining the high volume already integrated boards. This was just status quo. So I don't really think that needs to be a recommendation unless you guys feel otherwise. If you really want this to be a recommendation, we can certainly move that forward. But the actionable recommendations would be this one, developing a behavioral health and psychology board proposal. So I can certainly develop that one and have it look just like the other recommendations and come up with some draft language as well. And then the healing arts licensing program, again, like I said, options 4 and 5 kind of blend into each other. And so this would be one recommendation, and then this would be the second recommendation regarding board governance, if that works for everybody. Okay.
Okay, sounds like it does.
Okay, great.
Okay, we'll move on then. And so we'll go to C on our agenda. Outstanding emerging issues and any recommended review. Ms. Sullivan, do you want to tell us how you would like us to proceed on this portion and what you need from us for
Oh, okay.
approval or not? Or I can talk about it a bit?
Sure. So this one, for item C, we have a couple things that have just been outstanding for the duration of the task force. And so I wanted to bring back the telehealth conversation. And there was a couple, so you received another memo and a revised recommendation basically for telehealth that we can go over. And this would be at the last meeting, at the June 8th meeting, we kind of touched a little bit on telehealth, and I think there was maybe a little bit more information that was needed. I can't recall. So if you guys want to refine your recommendation for telehealth, then you can do that with this recommendation. And then there was a couple other follow-up questions that had come about just in conversations. One of them is the potential of moving the CNA licensing from a registration at GPHHS to a licensing program at DLI. And so that is a policy recommendation that we can cover. And then also there was talk about potential apprentice licensing and then the idea of nursing career ladders for workforce development. And that all aligns with the RHTP Initiative 1. And so those are three papers that I think this committee should review and hopefully can adopt those recommendations to move forward to the August 21st meeting. And then finally, there's just one other, this was a public comment that came in regarding a nursing rule change recommendation, and it came in after after I compiled all of the recommendations from public comments, and it's a pretty simple but quite effective rule change recommendation that I would like this committee to look at. So if it's okay, Madam Chair, we could just go in that order.
Sounds good to me.
Okay. Okay. This is the telehealth policy recommendation. Did you want me to go through this, Madam Chair, or did you have stuff prepared?
Yeah, I have stuff prepared to talk about it. So with the telehealth policy, we received good assurances that Blue Cross Blue Shield and other insurance companies and programs support telehealth and are already doing so from the representative that we had when we had the billings meeting here. So realistically, telehealth is already a permanent part of the Montana healthcare system. And moving forward, I think, Ms. Sullivan, we can just make sure that everyone knows that we support this, and we strongly encourage insurance providers and other providers to continue providing telehealth where appropriate and paying for it. That's a fair assessment for you?
Yes, Madam Chair. So at the bottom of this this document, there's four different options that you could adopt. So I don't know if anybody has any any ideas on which one you would like. Just final recommendation only, preserving the current telehealth authority, continuing to monitor implementation barriers, or if you'd like to actually direct a formal rule and policy review, any of these options, or would you like to combine all four of them in your recommendation?
Any thoughts from the committee on which one of those would be best to move forward? Do we want so that we have assurances for patients and providers to maintain access to care? Does anybody have any, Representative Buttrey?
Thank you, Madam Chair. Yeah, we did hear in the Billings meeting that there already is telehealth parity, both on the government payer side and on the private commercial side. So I don't think option C is needed. I really don't think that it's a good use of time and the state's dollars to do option D. I like option A because we can show that we do support current telehealth authorities, but to tell the boards, hey, if you start to see any barriers towards the use or implementation of telehealth in the future, keep that on your radar so that we can get rid of those barriers. And then option B, I can support as well, just to make sure that the department is also looking at this and making sure that we're not implementing any barriers to telehealth. So I like A and B, certainly A at the least, but I'd support B as well.
Thank you, Representative Buttrey. Ms. McCauley?
Hi, thank you, Chair. I would support all four options. I am good with dropping C if that meets the muster of the committee. I like that we formalize and adopting the rule set that protects this ongoing, and that it isn't just it's fine now, but who knows what'll happen down the road. So I would like absolutely A, B, and I do like C still and D. Thank you, Chair.
Mr. Brown? Thank you, Ms. McCauley.
Webb Brown, Montana Dental Association. Thank you, Chair Etchart. I would agree with keeping option A. I don't know that the others are necessary. I guess I would ask Dr. Harrington maybe to speak to option B. It's additional work that we're putting onto DPHHS, DLI as well. And I think that option A actually satisfies that. So and even though DPHHS hasn't specifically noted in option B, I'm wondering if he has any thoughts on that.
Yeah, I do. We consider telehealth to be absolutely critical, especially to the RHTP initiatives, and we spent a lot of time looking at it, and there is an internal review ongoing. It's not totally formal, but I have an extensive interest in this, and so it's absolutely critical that we carry this through and don't create barriers for this, especially as rural health is concerned. So I guess the short answer is, yeah, we're on it.
Representative Buttrey, did you?
Sorry, I just didn't take my hand down. My apologies.
No worries. Dr. Harrington, do you have anything? Okay. So from kind of what I'm hearing from the committee is it might be best to move ahead with both option A and option B just to make sure we have everything covered. Will there be any objections to that? And Ms. Sullivan, would that cover what you need?
Yes, ma'am.
Okay. So we'll move ahead with option A and option B as recommendations from the committee for the August meeting then. And then we will move on to the CNA portion of this. So currently CNAs are managed under DPHHS. And it would be nice to move CNAs to DLI, where everything is currently taken care of in terms of licensing through the boards and the programs. This keeps everything streamlined, possibly removes administrative barriers, and that the department that specializes in this, not that DPHHS doesn't do a great job, they do just fine. This is not a criticism of that at all, but it's just to move everything under one department for ease, for consistency. So I think it's actually pretty straightforward. We've talked about this a lot. I'm happy to address this more. If anybody has any questions, you'll see Ms. Sullivan's put up the division of responsibilities currently on the screen. So Ms. McCauley.
Hi, thank you, Chair Etchart. I thought that this might be just a good time to offer a small amount of context on this. We clearly have a nursing shortage, and the pipelines and the set situations we have in place are not going to be able to address that long term. CNAs are a great foundation, and there's a lot of interest in the CNA community, to become LPNs and to learn more and take educational advancements in that. And a lot of these people are unable to move for education, unable to are not advancing and are not supported in their advancements. And they are just a great workforce community. And the registration program that has adopted this has grown that. The Board of Nursing and our administrations, our staff created an educational program and testing that allowed them to become medication aides. And so pulling them into a little closer context, a little closer contact with the Board of Nursing will allow us to encourage them, grow them, give them more educational opportunities, give them more like endorsements potentially. And I think this is a fantastic idea to begin a little more advancement in the educational portion and address a critical shortage that we have now and is expanding. And I give overt support for this.
Thank you,
Thank
Ms.
you, Chair.
McCauley. Thank you. Certainly doesn't look like anyone opposes this. So Ms. Sullivan, I think we'll move forward with that initiative as well. And then in terms of discussing the nursing career ladders and then apprenticeships, of course, we know that this will also help with the RHTP initiatives that we have. And I think probably one of the best ways to go about this is I'm happy to explain this, but this would give CNAs, LPNs, and then LPNs can advance to RNs without lowering educational or licensure standards. And public testimony highlighted barriers such as limited rural nursing programs, waitlists, financial constraints, and the difficulty of attending school or working full-time. Montana already has a statutory authority recognizing apprenticeship pathways for several nursing professions and creating an opportunity to build structured career ladders under new existing law. So, Ms. McCauley, you might be the one who has the most experience here to explain some of this. But this would be a CNA to LPN program and an LPN to RN program. And the proposal would emphasize that the existing Board of Nursing oversight and licensure standards remain unchanged, and apprentices would not practice independently before licensure, and apprentice registration would primarily provide title clarity, supervision standards, competency tracking, and employer confidence, and not expand any scope of practice. Thanks, Ms. Sullivan, for putting that up. But Ms. McCauley, would you like to provide more insight on this?
Sure.
If you would, thank you.
Sure. Thank you, Chair. It has already started just simply out of obligation, as I kind of touched on earlier with the medication aides. The long-term care facilities needed more people to administer medications. And so the Board of Nursing, we oversee the educational programs, the nursing programs all across the state at the LPN programs, the RN programs. We oversee them. Our staff does site visits. So we're already overseeing the educational component, and there was some public comment that offers some concern to that. And so we are the authority that validates that. And so at every step, you can see in this stackable credentials that there's some reference to education and there's timing. And so this just allows for side of learn in your location, learn in your apprenticeship, the policies and procedures at these facilities are based on how they're done and taught in the educational standards. And so these are a way to encourage, adopt the apprenticeship program in a stackable way that also has the supervision, the educational component, and doesn't authorize any unlicensed practice. It's a matter of oversight and education, and I think it's developed in a way that will allow this to happen in a rural setting, which is the definition of Montana in many ways. There are a lot of programs that are already designed for this through the educational programs. There's advanced practice programs nationally that do this in an educational role through a educational institution. And this is not a new idea, other than it's being administered through the department. And I think I'd be glad to answer any questions or direct that as that comes up. Thank you.
Representative Buttrey. Thank you, Ms. McCauley.
Thank you, Madam Chair. Yeah, I really appreciate what Ms. McCauley just said, and I think it's something folks need to realize is that we're not changing supervision, practice limitations, regulation by doing this. What we're doing is providing for a career ladder, from that CNA to Med Aid to LPN and RN, where folks are getting their education while they're actually working and earning a living, and they're filling a tremendous gap that we've got in our workforce in healthcare right now. I think this could be one of the most important things that we do on this committee. So I wholeheartedly support it, and I hope we can move this one forward.
Thank you, Representative Buttrey. Dr. Harrington?
Yeah, I want to build on Representative Buttrey's statements. As chair of the governance board for the state hospital and having had the health facilities division, this would be absolutely critical to recruiting. As he said, it does give a career path to people, and it gives them a real incentive to come on at that level, knowing that they have the opportunity to go forward. So from all 7 of our facilities, this would be a huge benefit. And actually, 2 years ago, I did meet with DLI to discuss what we called an apprentice program. And so we're very much in support of this.
Thank you,
Chair,
everyone.
if I may.
I don't see a hand raised.
Chair, if I may.
Oh, it's Ms. McCauley. There you go. Yes.
I just wanted to end with a piece on this, that I think that there's a part of this where when you can learn in your and make a wage and grow this, I think this is family support. I know that's not what we're here, but I think it's something important to just mention that this would support families because you can learn and earn at home. And I just wanted to add that little piece. So I think this supports families too. Thanks.
Thank you for that, Ms. McCauley. Okay. Well, I think we had excellent support for this. Good job, team. Ms. Sullivan, then we're clearly moving on with that recommendation. And then, go ahead.
Thank you. Yeah, I don't know. I don't think I need anything else. I have this all built out, so I'll get it finalized for the next meeting for everybody.
Okay. Does anybody need us to do an overview of the recommendations? I mean, we could, but I really don't think in the interest of time we need to do that. They're right there for everyone to read if they need them. Okay, perfect. So the out-of-state nursing rule, there was some public comment submitted to the board or to the licensing task force. And I'm not sure if any of you read that or not, but it's addressing the severe nursing shortage and allowing nursing students to come into the state of Montana as part of their training. I think in one of the hopes is that they would want to stay in Montana. And so it just allows out-of-state placement. Ms. Sullivan, do you want to give a better summary of that? Or I have summary points here. I'm happy to read the summary points of that article, or you can.
I would defer to you or Ms. Stallkamp because this is not my area.
Okay.
Rules are not my thing.
So this would focus on the Rule 24-159.608, which requires out-of-state nursing programs to obtain verification from directors of Montana nursing programs that placing a student in a Montana clinical setting site will not displace a Montana nursing student. So one of the things that this hopes to address is that Montana continues to face a severe nursing shortage, especially in rural and frontier areas, and expanding nursing education pathways can be viewed as essential to increasing workforce. The current rule effectively allows existing Montana nursing programs to influence whether competing out-of-state programs may use Montana clinical sites. And of course, this was put in place to make sure that our students in Montana have first dibs at a placement, because sometimes finding placement is very difficult in your trainings. So this comments that were submitted argue that this is anti-competitive and uncommon nationally. And according to the comment, only California has a somewhat similar requirement, and California's rule is substantially less restrictive. So Montana appears to have one of the most restrictive rules for allowing out-of-state placement for clinical education sites. So one of the arguments was that the rule restricts competition among nursing programs. It limits clinical training opportunities, and it actually reduces educational options for Montana students. And so it also apparently discourages innovative models such as online, hybrid, and competency-based nursing education, and it slows efforts to address Montana's nursing shortage. So the rural impact of this is that it could expand opportunities for students, and it could increase access in rural communities. So that's just a very brief overview of some of the recommendations for this. Ms. McCauley, did you have some more comments?
Thank you, Chair. I did want to just, I realize how it's written and that it will not displace a Montana nursing student. I think I just talked a little bit about the Board of Nursing's oversight for the educational programs. And the only caveat that I would kind of put in here is we don't have any oversight or understanding of the educational level and the competencies of the programs of the students from other states. So I do think that there's a place where we don't want to make it look like a competency thing, or sorry, a competitive thing where we absolutely want students come into our facilities and take up some internships, apprenticeships, or clinical opportunities to address the nursing shortage. So I support that part. And the way it's written does speak to the restriction of competition, which I think we need to remove or address for sure. But the secondary part is we do not have any educational understanding or verification of those ones coming in. So there's a piece of that I think should be retained.
Thank you, Ms. McCauley. Any other comments? Okay, so Ms. Sullivan, then would it be fair to say that our recommendation moving forward is a review of ARM 24-159-608?
Yes, so this one, I'm going to have Jennifer help me out a little bit on this. So we are very, very close to the timeout period. I can't remember what it's called, blackout period for making rules. I don't think the Board of Nursing is meeting until after the end of July. Is it July 28th? Is that right? Next week?
Yeah, July 28th is the drop dead date for rule proposal notices. The nursing board does have some rules that are scheduled to be proposed before then, but getting the board together and getting the necessary approvals prior to the 28th would be difficult.
Okay.
And I think Ms. McCauley, I
We
will
had,
speak
thank
to
you.
your
We had our
time.
board. We
Yeah.
had the board meeting just recently, and we've already submitted the ones for this session, and it's already a tight. I don't think this will make it.
Okay.
No, but certainly the blackout period, for those of you who don't spend your time in administrative rule land like I do, the legislature has prohibited administrative rulemaking in the last 3 months leading up to a legislative session so that the legislators can focus on bill drafting and things of that nature and not having to worry about reviewing administrative rules. So we do have that blackout period, but certainly task force, the recommendation could be to review the rule for anti-competitive behavior, and if there is another less restrictive means of achieving the same goal.
That's all great information. Excellent. So I think if we just make the recommendation, we still just make the recommendation to move forward, given the time constraints and anything else that we need to, and it would move forward at an appropriate date. Ms. Sullivan and Ms. Dahlkamp, Ms. McCauley, will that fit the bill if we make that recommendation to just move forward with appropriate timeframes?
That sounds good with me. Thank you.
Fine with me, Madam Chair. Thank you.
Excellent. Thank you, ladies. Any other comments or concerns? Okay, I think we can move into updates on compacts. So I'll just give a few updates on compacts. In Children's, Families, Health and Human Services, we had a study bill on EMS. And during that study bill from EMS, as well as other compacts that have come up and reducing barriers to care that we've looked at in that, Children's, Families, Health and Human Services has moved forward with moving the EMS compact as a committee bill, as well as moving the social work compact forward as a committee bill. So those two are moving forward with Children's, Families, and Health and Human Services. So those will both be pre-introduced bills through there. And then the other ones that we're looking at our last meeting in September 9th, we're also looking at the APRN compact. We're going to have a quick review of that. We're also looking at dentist and dental hygienist compact, as well as podiatry compact. So those are different things we're looking at through that committee. And one of the things that I just stressed through that committee is because we would certainly want to, with these getting consensus from the healthcare licensing subcommittee, getting them pre-introduced as a committee bill just ensures that they're in the system right away through session. So it keeps the system, it keeps bills flowing, it keeps committees functioning at optimum capacity, and keeps the flow during session. So does anybody have any questions on any of these compacts or comments on moving them forward and how we're going to get them moved forward?
Madam Chair, I'll just say, if I can, that workforce in the healthcare arena is a really big issue. It's a big part of RHTP. I think these compacts have provided great benefit to Montana, and any of these healthcare compacts, I think we should, if we're not going to be asking to bring something forward, I would really like to have a statement that we support the introduction of these compacts in the upcoming legislative session.
Representative Buttrey, thank you for that. I think that's a great idea. And we will be sure to move that forward in minutes from this committee, that it looks like everyone supports this. And Ms. Sullivan, we will make sure to include that in our August 21st meeting in Butte, that we support these compacts. Mr. Longcake.
Yes, Madam Chair, thank you for taking the action on these several different items. I really think the dentist, dental hygienist one is very impactful, especially since there's so much emphasis on that particular business segment and in the RHTP. So thank you for taking that up in committee, and we support that fully and happy to help in any capacity that we can with any of your needs. So thank you, Madam Chair.
So, Madam Chair, if it's okay with the subcommittee, I would like to draft a recommendation for the August 21st meeting that specifically lists all 5 of those compacts, that the healthcare subcommittee supports all 5 of those compacts for the 2027 legislative session.
Ms. Sullivan, I think that it looks like you have support with that. And so absolutely, we'll move forward with that. Thank you.
Okay, thank you.
Okay, Ms. McCauley?
I was just want to clarify that these compacts will be on our recommendations at the end of this, or?
So yes, Ms. McCauley, and then I'm happy to address some concerns that were barriers before with getting some of these compacts through that we've discussed in, if anybody has any questions about, but it seems like everybody does want to move these forward. But there was one specific barrier with the APRN compact, and there's changes with the compact at the national level. One of the barriers was that it lists in the compact that APRNs have to have 2 years before they can practice in any other compact state. And Montana does not currently have that recommendation. APRNs can practice immediately upon graduation from an accredited school. And so in order for them to practice in another state, they would have to have 2 years before they could move to that compact state, and of course, vice versa. And it was felt that that was a limitation to APRNs in Montana, and that it could possibly maybe change some of the statutes in Montana and require 2 years of residency type training or practice before they could practice independently. And so given that that was a barrier, that is being taken out of the compact nationally. And so the way to get around that, to ensure that our APRNs in the state of Montana have complete autonomy and that there's no limitations to their current practice in the state of Montana or other states, that we in Children's, Families, Health, and Human Services have I believe it's called a contingent or provisional draft, that it would, as long as the APRN compact nationwide removes that 2-year requirement, that Montana would join the APRN compact. And that was the large barrier going forward. And I absolutely understand that. And I am excited to say that with Montana opposing those unnecessary barriers, that it's caused the entire nation to look at that and realize that that's a barrier. So good on Montana once again. We are the leader in the nation in healthcare reform. And so I'm happy to say that I don't think there's any barriers with the APRN compact going forward due to that 2-year requirement being taken out. Did that just confuse things, or does that help people? And is everybody okay going forward? Ms. McCauley?
Thank you. I just want to, we've got a lot of support for the compacts. I just want to make sure that we're able to have this as a recommendation and an action item by the time we come to our full task force meeting and finish this out with the governor and the report. Is that on the table? Is that?
Absolutely. We're moving it forward both in Children's, Families, Health, and Human Services interim committee. And I think that from what I understood, just with the consensus of the entire committee here with the healthcare licensing subcommittee, that it's a recommendation to move all of these 5 compacts forward. Would that be a correct summary recommendation, Ms. Sullivan?
Yes, Madam Chair. So so just kind of to recap, the Healthcare Subcommittee and the full task force has already approved the recommendations for the EMS Compact and the Social Work Compact. And so now concurrently, the Children, Family, Health, and Human Services Interim Committee has decided to pre-introduce or to consider pre-introducing both of those compacts in their interim committee work. So those two seem to be on track. The consideration now is for APRN, the dentist and dental hygienist and podiatry compacts. And so what my ask is that we put forward a recommendation from the Healthcare Subcommittee in support for the 2027 legislative session that all 5 of those compacts be moved and enacted. And that would be the recommendation from this task force. Now, who introduces that? If it's children and families, or if it's an individual legislator, then that remains to be seen. But that's what this subcommittee is. What I'm asking this subcommittee to recommend is moving forward all 5 of those compacts.
Mr. Brown? Thank you, Ms. Sullivan and Ms. McCauley.
Thank you, Chair Eckhart, Webb Brown, Montana Dental Association. We're generally supportive of the dental compact as well. With the issue remaining, one of the barriers that was in existence is gone now, so that's good. But one of the other barriers, potential barriers, is cost. We still want to know what the cost is going to be to implement that compact and who's going to pay for it. So hey, I'm fine moving it forward, but before we would provide support, we just need to have that one clarified. Thank you, Chair.
Thank you, Mr. Brown. So, Ms. Sullivan, I'm not quite sure, I don't want to catch anybody off guard, but if Mr. Bragg or Ms. Stallkamp could provide any of the cost assessments with that. Mr. Bragg?
Thank you, Chair Eckhart. I was hoping you'd get to see my tie today. It's great to see everybody. Last legislative session, when we put in fiscal notes, I believe the amount that we calculated for implementation was around $13,800. I think was our initial cost assessment for implementation of each of the compacts. And so broadly, that is the cost for the department to implement those compacts, and the costs are borne by the licensing boards.
Thank you so much, Mr. Bragg. So we saw that that was $13,800. Ms. Sullivan, can you somehow include that in the recommendations going forward within that, maybe making that as an estimate, not as a hard number, just in case for increased costs and things like that, so that we have that number when we go into the August meeting, please. And then Representative Buttry.
Thank you, Madam Chair. I'm just going to reiterate, I think what we're saying, and I think it's critically important that this task force committee does forward a recommendation of support for the introduction and implementation of all 5 of these compacts, no matter who the person or entity would be that would introduce them. I think that's critical that we get that in our report. There may even be other compacts that might pop up, but I think we've got to show full support for all of the compacts. Thank you.
Thank you, Representative Buttry. And then in the interest, just to continue to talk about this, but that in the interest of pre-introduction, Children's Families Health and Human Services is going to do the very best we can to help with the 406 Jobs Initiative, the governor's licensing task force, to be able to pre-introduce these bills and have them ready to go on day 1, so that we keep the flow in the session as we all work for the people of the state of Montana to move things forward and do the very best that we can to increase jobs, increase access for healthcare, because that's what we're all here for. So that's just why I emphasized the committee bill for pre-introductions. So yes, we'll move forward with all 5. Excellent job, you guys. Okay, we'll move on to the next 2 items on the agenda. Again, we will have the next full meeting of the entire task force in Butte on Friday, August 21st. And Ms. Sullivan, if you would please give us any information that we might need on logistics regarding that meeting.
Yes, thank you, Madam Chair. So the meeting will be held at Montana Tech. I can't remember the name of the building. So, but I will have a map, and from what I've been told, that they will not be ticketing for parking, but I'll have a map with like the parking lots right next to the building that we're in. It's not going to be at the Student Union building because they are actually having student orientation that same day. But I'm assured that they won't ticket us for parking, but I've asked for them to provide some sort of a parking pass or something, and so we can identify that yes, we are here, we are allowed to be in this building, and all of that. So more information to come. We had a meeting with them just this last Monday, and I asked for all that information. The agenda is not set yet, but anticipating a mid-morning start, and then we'll go until we finish. And so you should all have gotten an email from me with some room blocks if you need to travel and stay the night before, or if we go late and you have a long ways to travel and need to stay that night. It is on a Friday. So there's 2 hotels available. One of them, the block was only available that night, and then I think the night before, that Thursday night, and then the other one has a 2-night option. So just take a look at those. Take a look at the deadlines as far as when the room blocks expire. I think towards the end of the month or the beginning of August. So as soon as I have a draft agenda approved, I will send it out. But basically, the idea is that we will have each of the subcommittees, just like last time, present the recommendations and go through and prepare the final report. It'll be a lot more detailed and a lot more conversations, because this is our last meeting and we do have to get that final report prepared for September 2nd. And then there will also be time for presentation of the survey that was briefly touched on, that I'm not going to steal Kevin's thunder, but Kevin is working on a survey for for something. So, anyways, there will be something on that. And then, of course, lunch will be provided. So that's about all I have for that. Again, more to come as we get that agenda finalized, Madam Chair.
Thank you, Ms. Sullivan. I appreciate that. Any more comments from the committee before we move to public comment? Okay, so for public comment, the subcommittee now offers the public in attendance an opportunity to comment on any public matter under the jurisdiction of the subcommittee that is not on the current agenda. The subcommittee cannot act but will listen to comments and may ask staff to place the issue on a future agenda. The chair may limit the comment period to proceed with the subcommittee meeting. And then any public commenters should state their first and last name when offering comments. Ms. Hensley.
Thank you, Madam Chair. Sorry, I was a little late there to raise my hand. I just wanted to just make a note for those of you who are about to give public comment. Thank you for a gorgeous July Friday morning that we're all on a conference call, for showing up. And also at the last meeting, I threw out an idea of massage therapy combined with cosmetology. I've spoken directly to not only my personal massage therapist, but a couple other business people here in my community. I've read all the public comment. I just wanted to, for the record, yet again, that was a suggestion I was throwing out, that, and fully acknowledging that I did not possess all the information around it, but I thought it was an intriguing concept. I've read throughout the public comment. I will not be pursuing that idea, for the record. I don't know if anybody else will be either, but I did want to just sort of inoculate some of these public comments that may be more on the ardent side of opposition. As far as I'm concerned, that idea is dead. I have no idea what anybody else here thinks, but I just wanted to assure folks.
Thank you, Ms. Hensley. And so I will just reiterate that as we looked at our prior agenda items, that that was one of the agenda items, that moving optometry under the Board of Medical Examiners, or converting it to a program, or merging massage therapy and chiropractic into an alternative healthcare board. Those were proposals that did not receive enough support and are not moving forward as a result of this committee. So absolutely correct. For anybody that wants to make comment, please absolutely make comment, but rest assured that, again, those proposals did not receive enough support and meet the threshold for moving forward as recommendations from this subcommittee. So for comments, just know that going forward. Thank you again, Ms. Hensley. Any other comments from the committee before we move to public comment? Okay, we'll move to public comment.
Would you like me to call on them, Madam Chair?
I do not see any hands raised, so yes, please.
We'll start with E. Hayden, and if you could say your full name, please.
Hi, my name is Erin Hayden. I'm with Associated Bodywork and Massage Professionals. I am looking back at the licensing boards and program survey results. My understanding from the discussion in the meeting is that option 4 and 5 are actionable, with option 1 as an avenue that may possibly continue to be explored. I would like some clarification on where the massage therapy board may be placed, if you can offer any insight.
So Ms. Hayden, thanks for asking that. I'll just reiterate that the proposals that were surveyed through the committee did not receive enough support to move forward, and that was to merge the massage therapy and chiropractic into alternative healthcare board, and also to move optometry. Those two did not receive enough support for us to consider moving them forward. So this Governor's Healthcare Licensing Task Force Subcommittee is not moving forward with any recommendations for massage therapy. However, if someone would choose to do that in the session, that wouldn't preclude anyone else from doing it. But in terms of this committee, for the purposes of this subcommittee, we are not moving those recommendations forward. Does that help, Ms. Hayden?
So what would happen to the board is what I'm asking. Would it be eliminated?
So we are not making any changes. So the status quo that's current, that we are not moving forward with any recommended changes with that at all. So it is what it is, and we won't move forward with any changes. So we're not even addressing it. We're leaving it. Does that help?
Yes, perfect. Thank you so
Okay.
much for answering that question. I appreciate it.
No problem, Ms. Hayden. We're happy to help. Ms. Hensley?
I'm so sorry, Madam Chair. I did just want to clarify because I am that student that always asks for homework. I did want to clarify, though, for anybody listening, this subcommittee is not going to forward it on. And during the full licensure task force meeting in August, there will be general discussion where somebody else could bring it forward and it could be adopted by the body of the whole. And the department and the governor's office could also move forward with their own suggestions for your board. So I just wanted to clarify that just because I deal a lot with members of associations, and my motto is always stay vigilant. So please don't not pay attention, but just know that procedurally it could pop up in the future, or other things could happen with the Board of Massage Therapy, right? So I know that we're moving forward with healing arts and it could be included in that. So I just wanted to make ultra clear, not that the chair didn't, but thanks for that.
Sure, no problem. And also just kind of make a comment in terms of public comment. Typically public comment, and it's not really a dialogue. So that was a little bit out of the norm. So going forward with any more public comment, I just want to let you know, probably won't do that. We'll just allow you to comment. However, I wanted to make sure that Ms. Hayden, she had a very reasonable question, and I wanted to make sure that that was answered for public comment. So Ms. Sullivan, any more hands raised?
Yes, ma'am. Marty Wingen.
Hi, my name is Marty Wangan, and I'm the Executive Director of the Montana Psychological Association, as well as the Montana Podiatric Medical Association, and would like to make comments for both. First, for combining the Board of Psychologists with the Board of Behavioral Health, MPA respectfully asks the task force to reject this recommendation and preserve the independent Board of Psychologists. First, the proposal does not address or reduce any licensing barrier. Combining the boards will not make it easier for qualified psychologists to become licensed, nor will it improve public access to psychological services. On July 7th, the Board of Psychologists held a public meeting and received input from its licensees regarding the proposed consolidation. The testimony received during that meeting demonstrated clear opposition from practicing psychologists. Following that discussion, the board voted to seek permission from the governor to formally oppose the proposed consolidation. It's also important to recognize that the Board of Psychologists is funded by the psychologists it licenses. These licensees pay the fees to support this board and for the work it does. Those stakeholders deserve to have their voices given substantial weight in this process. So again, we respectfully ask the task force to reject the recommendation. For podiatry, we would like to thank the task force for its work on the compact. We appreciate the recommendation to support the podiatry compact moving forward. Thank you.
Thank you so much, Ms. Wangan. And then Ms. Sullivan, any more?
Yes, Michelle McKinney.
Good morning. Can everyone hear me?
Yes.
Great, thank you. My name is Dr. Michelle McKinney. I'm a licensed psychologist in Bozeman, Montana. I'm speaking for myself individually and also on behalf of the Montana Psychological Association as a member of their legislative committee. I'd like to let the task force know that I have been training and supervising postdoctoral psychology residents since 2014 toward licensure. So I have a fair familiarity with the Board of Psychology and the ways in which it works. And I'm speaking out with a request to reject the proposal to consolidate the Board of Psychologists with the Board of Behavioral Health And I have a couple of reasons that I can elaborate on. I think that the Board of Psychology over the last 3 to 5 years in particular, maybe a little bit more, has actually successfully reduced barriers to access to licensure for psychologists. They've implemented numerous rule changes to ease the pathways to licensure without compromising competence. And as one of my colleagues mentioned at the Board of Psychology meeting, that this looks like a solution in search of a problem. I think that the Board of Psychologists has already successfully addressed the issue of barriers to licensure. In addition, I think that consolidating the Board of Psychology and the Board of Behavioral Health may look good on paper, but it is our understanding that licensing boards serve to ensure public safety needs, and we have significant concerns that this move would increase risk to the public. Our scopes of practice do overlap in one area. Everyone on the Board of Psychology, well, not everyone, but many on the Board of Psychology and the Board of Behavioral Health provide psychotherapy. But psychologists and behavior analysts who are also subsumed under the Board of Psychology have very specific and unique areas of training and practice that distinguish us from the groups who are overseen by the Board of Behavioral Health. And many of these situations or these areas of specialized training are the ones that are more likely to trigger board complaints. In particular, psychologists conduct forensic evaluations, including competency determinations and not guilty by reason of mental illness. And this is one specific area where psychologists distinguish ourselves from those served by the Board of Behavioral Health. We also conduct neuropsychological evaluations for dementia, traumatic brain injuries, employment accommodations, academic accommodations, things of that nature. We conduct parenting plan and custody evaluations that we all know can be very contentious. And also to speak to the behavior analysts, they are trained to conduct specific behavioral interventions for managing and treating autism and individuals who live with autism and their caregivers. And these are ways that we have distinguished scopes of practice and areas of practice in meaningful ways that I think the public would be poorly served to have the board consolidated. I speak for myself and all of my colleagues in requesting that you seriously consider our voices and our opposition to this action. Thank you so much, and I'd be happy to answer any questions moving forward from the subcommittee.
Thank you, Ms. McKinney.
That was the last hand, Madam Chair.
Okay, excellent. Thank you everyone so much for the meeting today. And then just one last time, any questions or comments from the committee members before we adjourn? Thank you, Ms. Sullivan, Ms. Stallkamp, Mr. Bragg, and Mr. O'Connor for all of your hard work with this. Thanks to the subcommittee. And we will see you all on August 21st in Butte. Meeting is adjourned. Thank you so much.
Thank you.